Doctors say the death of former Secretary of State Colin Powell from COVID-19 is a powerful reminder for immunocompromised people to get their additional dose of vaccine. And tonight we're learning some doctors might even administer a fourth dose to people with severely weakened immune systems. I told you Monday Colin Powell was fully vaccinated and died from COVID complications. But we've also learned he was battling a blood cancer called multiple myeloma.
It affects one's blood cells. It affects white blood cells. It affects both the T cells and the B cells, which are responsible for the immunity we get from vaccines as well as natural immunity.
By that account, Powell would have been a candidate for a third dose of vaccine. A longtime aide told the Washington Post Powell received his second Pfizer shot in February. He was supposed to get that extra dose last week, but missed his appointment when he got sick.
It certainly is possible, very possible, that if Colin Powell had received the third dose of vaccine, that third dose may have triggered enough of an antibody response such that he would have been in a better place, better able to fight off the COVID infection.
Dr. Charles Bregier with Novant Health says that's because each dose in this extended vaccine series boosts a person's chances of making antibodies. And he says in some cases, a patient might need another dose after that.
It's even recommended for some people who are significantly immune compromised that they go ahead and get a fourth dose of COVID vaccine if they're thought to be significantly immune compromised or have their blood checked and find out they have zero or low antibody levels.
Now, in its guidance for additional doses, the CDC writes that a person shouldn't receive more than 3 mRNA doses, but it also doesn't have any specific recommendations for getting a booster shot and then an additional dose at this time. Of course, that could change down the road. Bregier says that a person should talk to their doctor about that possibility of a fourth dose. Of course, a lot of information out of there and a lot of new developments really can be confusing, we know. So if you have any vaccine questions, we do want to help. You can text your questions to us. There's the number, 704-329-3600. Our team will do our best shot that we can to get back to you as quickly as possible.